And now it's time for The Doctor is In. And this morning we're talking about cataracts and the new advances in cataract surgery. And joining us this morning is Dr. Christopher Tortora, the medical director and an ophthalmologist with the Hawaiian Eye Center in Wahiawa. Good morning, doctor, and thank you so much for joining us.
Good morning. Thanks for having me.
And we've been talking about cataracts during the commercial break, and it's not necessarily something you can see if you're just looking at someone. What exactly is a cataract?
Well, a cataract is actually a cloudiness inside the eye. It's the lens of the eye becomes cloudy, and that interferes with the vision. And when it starts to interfere with the vision enough to make it hard for you to see or do what you want to do, then you should take care of the cataract.
And it is very common. What percentage of the population do you think actually gets cataracts, and how old are they?
Well, cataracts are actually more common as you get older. It is an age-related change. The lens of the eye gets a little cloudy. Sort of like your hair gets gray, the lens gets cloudy, it gets worse as you get older. And when it reaches the point where the vision starts to be affected, it should be treated, and that's more commonly as you get older. People in their 60s and 70s are the most common people we treat with cataracts.
And there's an eye right there. You can actually see, that's a pretty advanced form of cataract right there.
Normally you can't see a cataract, but in this case, this patient had a pretty advanced cataract, as did this one, and so those were cataracts you could actually see looking at the patient.
And there's actually new things in surgery now that you're doing to help remove the cataract, right?
Yeah, cataract is removed with surgery, and the surgical techniques have advanced over the years. What we're doing now is we're doing it in a shorter time in an outpatient setting, so it's quicker, faster, easier for the patient. But we're also able to offer the patients a little bit more in terms of added benefits for cataract surgery. We can offer them the advantage of reducing the dependence on eyeglasses. Often with newer technology, we can focus vision both distance and near after surgery using special lens implants, using special measurements that we can do in the eyes, and by doing that we can restore a much more youthful vision, much distance, near. People who get over 40 often can't read anymore, and so we can sort of restore that after cataract surgery with some of these elective procedures.
And how long does something like this last, a surgery, and is it painful?
Well, an experienced cataract surgeon usually does a cataract procedure in about 15 to 20 minutes. It's completely painless. It's done in an outpatient setting, which means you're in and out the same day. In our center, we use a ambulatory surgery center, which means you don't even go to a hospital. You just go in and out of basically the office. And so it's comfortable, and it's not as dreaded as it used to be. Yeah,
you know, my grandmother had cataracts, and I've heard from other people, too, that they're just so worried about getting any type of eye surgery. And my grandmother said that once she got the surgery, she wished she did it earlier. So what do you tell your patients when they're just nervous about anyone touching their eyes?
Well, it is a safe procedure as surgical procedures go, and it's pretty quick and pretty easy, and the recovery is very fast. It's amazing with the modern surgical techniques how fast people are up and on their feet and doing their normal things. Some people even driving and doing normal things the next day after the procedure.
All right. Well, Dr. Christopher Tortora from the Hawaiian Eye Center, thank you so much for joining us. And the doctor's going to be talking about eye safety for the 4th of July coming up in the next hour, so we'll see you then.